Welcome to the Enterprise-Wide Employee Wellbeing webinar. We thank you so much for your time. Just a little bit about the vision of the Employee Wellbeing team is to create the culture and environment where employees feel supported in all aspects of their work and life, allowing our people to do their best work. And one of our newer initiatives to support employee well-being is this webinar, in which we can highlight enterprise-wide experts like Dr. Adam Perlman, who will be speaking today on cultivating resiliency. Also, to let you know, Thursday, October 29th, Jody Nation will be speaking on pandemic perseverance. So after today's webinar, I'll send out more information on how to register for that webinar, along with links to other resources such as our workshops or our wellness connection groups led by our wellness coach if you're interested in participating in any of those other resources. So I'd like to introduce our presenter. Dr. Adam Perlman is a physician in the Department of Internal Medicine at Mayo Clinic Hospital in Jacksonville, Florida. He is the chair of the Florida Wellbeing Coalition. He specializes in the integration of lifestyle and other complementary modalities such as acupuncture or massage with more conventional medicine and a whole person approach. Dr. Perlman is board certified in internal medicine and specializes in both integrative and functional medicine. Prior to joining Mayo Clinic, Dr. Perlman was Associate Vice President for Health and Wellness for the Duke University Health System and Executive Director for Duke Integrative Medicine in North Carolina. So if you have any questions, you can submit them through the Q&A, and I will turn it over to Dr. Perlman.
Great. Thank you, Bridget. I appreciate that very much. Let's see if I can pull my slide up. Great. Always nice when technology works. It's really a thrill to be asked to be the first speaker for this enterprise-wide well-being webinar. I'm really honored. It's been great to be here at Mayo. January will be 2 years. I really enjoyed my time here and getting to know and meet many of the people across the enterprise, obviously Florida primarily, but I've been out several times to Rochester and Arizona, and even spoke, I think, at a conference at that water park out in Wisconsin too. So hopefully get a chance to meet many of you in the future if I've not met you already on some of our other locations. Well, I'm going to talk today about really resiliency and things that we can do in this moment, things that we certainly could have done prior to this moment, and things that we can continue to do when this moment is past. Because I think, you know, the need obviously to care for ourselves, to be resilient, is not new. Like a number of things certainly impacting us here at Mayo Clinic, like telehealth, for example, aspects of things that we were talking about prior to this pandemic have been really accelerated or in certain cases amplified. And I think employee well-being, our well-being, the need to take care of ourselves is certainly one of those issues that really has been amplified by this moment. Well, let me say, I think this is not a continuing ed talk, but I have nothing relevant to disclose. I do want to, though, thank Alana Fink, who's a colleague of mine outside of Mayo, and Melissa McCrary, who is one of our PAs here in Florida, for providing me some of this content with the slides. I appreciate their support. So, again, we are living in an age of uncertainty. I mean, as I've said here, even prior to COVID, you know, much of our work environment, for many of us, our home environments, you know, we're very much in flux, and you know, we are constantly dealing with change, and that is the reality. But COVID-19, as I've already been alluding to, has really accelerated a number of aspects of both our home and our work lives. Of course, many here at Mayo are now working from home, telecommuting. Things have changed. Environments at home may have changed for many of you, with potentially children being homeschooled or certainly having been home for a prolonged period of time. And of course, we need to find ways of handling this new reality. I think really we need to find optimal ways of handling our reality, again, prior to COVID in this moment and then moving forward. And you know, the issues may have shifted a little bit. They may have evolved through this global pandemic, but the need has always been there. And so that need really is around cultivating our physical, our mental, and our spiritual resiliency. I think another way to think about that is, you know, how we might adjust our behaviors to try to live our best lives and live our best lives in this moment that many of us are calling sort of the new normal, but really moving forward, how can we live our best lives, and what are some steps that we can take? And certainly what I hope you'll find with this particular webinar is that there's at least one thing that you can take away. Maybe you knew it, but it reinforced something you already knew. Maybe it was a new thought, something you're willing to commit to do a little bit differently coming out of this webinar. And if there's even one thing that you take away from it that you find helpful, I'll certainly feel like I've done my job today. So again, I'm sorry, we're going to talk about these 4 areas: managing anxiety, making a self-care practice, creating work-life balance, or as I like to call it, work-life integration, and some strategies there, and then focus a little bit at the end on gratitude. It's really one of the antidotes to sort of handling moments like this in our lives, and this concept of post-traumatic growth. So again, we're going to start with managing anxiety. I want to start there by talking about this concept of emotional radar. So we've evolved really as a species, to sort of constantly be scanning our environment. And if we think back, let's say, thousands of years ago, to sort of the proverbial walking through the jungle with the spear, if you were walking through the jungle with the spear, and there was a rustling in the bushes, and you thought butterfly as opposed to saber-toothed tiger, you were much less likely to get your genetic material into the next generation. And so really we've evolved, and you read some of the evolutionary psychologists, interesting thinking around this, to sort of not only scan for what is going on in our environment constantly, but default to scanning for threats. And that's just a reality. Now, of course, when there was more saber-toothed tigers, or the proverbial, as I've said, saber-toothed tiger, that sort of constant scanning and defaulting to a threat really served us well. Nowadays, that rustling in the bushes is the next text message that's going off, the email, the cell phone ringing, whatever it might be. And so the sort of constant, there's a threat in my environment trigger has become much more of a detriment to our emotional, mental, and really even our physical health. So let's use an example here. Let's imagine, obviously, Mayo, we were going through transformational change even before COVID. Many industries were, in many ways, of course, looking at things that like technology and how that will impact us, and all the things that we were dealing with. But so much has shifted, right, in such a short amount of time. And for many of you, and I would invite you to sort of personalize this sort of to your scenario, you may have children at home, maybe people are in tight quarters, maybe haven't been able to get out as much, maybe there's some financial stress that's amped up, work has changed, it may be that you're working more from home, it may be that there aren't the same level of support people around you that there might have been, home has changed, everything feels to many people uncertain now, and it's easy to begin to feel overwhelmed. It was easy to feel overwhelmed prior to this moment, and again, this moment has really brought the concept and the issue of overwhelm to the forefront even more. And let's imagine within that scenario, within your scenario, you come home after a long day's work perhaps, and your significant other or spouse says, you're a workaholic. I barely see you now, and I'm sick of it. All you seem to care about is work. So how might you react? And again, maybe that was calling your mother, and she says, you haven't called me in 3 weeks, and what's wrong with you? How might you react? What might you think? What emotions might you experience there? And for each one of us, for scenarios like this, there's often a dominant emotion, right? Some of us may be more anger people. Some of us may be more fear or anxiety people. Some of us more dominated by guilt. Now, of course, we can feel a mix of emotions, but very often we have a particular dominant emotion that we might experience. So let's talk through this a little bit. Again, the threat occurred, a comment's made, all right, and how might I respond to that? Well, do a little quiz here. It's a little hard to tell sometimes, but let's say top left here. What do we think that emotion is? So this is a very common reaction. You might respond with anger. Now, when there's an emotional reaction, okay, there is a thought driving that emotion. So in this case, and with the reaction of anger, the thought may be, I deserve more support. You know, we've been in this relationship. We agreed that, you know, I was going to work and we were going to create this life that we wanted, and we have this mortgage now, and I deserve a spouse or a mate or a significant other that's more supportive. Now, if that tends to be a dominant emotion for you, there very often is, or even if it's not dominant, but when we are sort of experiencing that emotion, there's a particular triggering cause to that, sort of a value perhaps that you hold dear, that when it is when the switch is thrown on that, you get potentially very triggered. And so for anger, it's really this idea of violation of rights. So my rights have been violated. It could be the comment I just said. It could have been the person who cut you off on the freeway today and you got all upset about it. There's a perceived violation of rights there. What's the next one? Probably, again, the second of the two biggies that people tend to experience, anxiety. So what's the thought behind anxiety? In this case, maybe my work or my relationship will suffer. You know, oh my goodness, you know, I really can't be working so much, but if I don't do what I've been doing, you know, I know that's going to impact my job, or if I don't make some changes at work, I'm really worried about my relationship. So what's behind that? Future threat. We're worried about what may happen in the future. Now, I want to stop here too to say that a lot of what we tend to do is mind wander. Mind wander into the future, think about things that may be, and create, or mind wander into the past and kind of rerun through events that may have happened. Now, when we mind wander into the future, very often that wandering really creates anxiety, and often, again, mind wandering into the past creates anger. And again, we can't ever worry enough to affect the future, and we certainly can't go back and change things that have already occurred. So not that there isn't any utility to sort of reviewing things that may have occurred so we can learn from them, or certainly planning for future. But again, a lot of suffering that we create for ourselves has to do with this mind wandering, and it doesn't need to be that way. We can learn to better manage that. We're going to talk about some of that. What about the next one? Frustration. Maybe you feel frustrated. What would the thought be? There's nothing I can do. I mean, I'm trying to work as hard as I can. I'm trying to get home and be a good spouse. What's behind that? Lack of resources. That often leads to frustration. Sadness. I thought our relationship was better than this. You know, I really thought that he or she understood, and, you know, it's just not the relationship I thought it was. So there with sadness, there's a sense of loss. Guilt, another biggie for people, for many people. I've let my family down, or my loved one down, or whoever it may be. So what's behind that? A violation of others' rights. And it's interesting, actually I was just reading about this the other day, that it's not unusual for an anger person to end up in a relationship with a guilt person. Yes, there tends to be sort of a balancing there, which was interesting. Embarrassment. Maybe you might respond by feeling embarrassed. What's going on when you're feeling embarrassed? They can see I can't manage. I'm vulnerable. And there may be a loss of standing. So a loss of standing is something that could be very triggering. Now, again, we all can feel any of these emotions. This is just what often is behind it. And then finally, this idea of shame. And shame is a little different. It's a good person here should be able to do it all. I should be able to, you know, do all that is required of me at work. I should be able to, you know, be there for my loved ones, my wife, in my case, my 5 children, whatever it may be, my friends. And there it's, I fail to meet my own standards. Shame is really a lot of with sort of self-judgment. You know, I feel guilty when I violate other people's rights, and I feel bad about that. With shame, it's really, I am really feeling down on myself. So what can we do about these things? And again, I am in no way saying that the negative quote unquote emotions are all bad, and they certainly serve a purpose without a doubt, but they also can tend to create a lot of undue suffering, or we can tend to react maybe in a way that isn't consistent with our values, maybe yelling back at a spouse or a loved one or a child, as opposed to respond in a more thoughtful way that is maybe more kind of the way that we want to show up in this world. And so one of the keys here is by really early on detecting what you're experiencing, okay? And with practice, you can learn to do this even better, more quickly, and asking, what emotion am I experiencing, and what is the thought behind it? And there's a process, and this comes from a book I'd written a few years ago, so that time gave it kind of a catchy name for people to remember, of trap it, map it, zap it. But this comes out of positive psychology, and the idea is, in the moment, and we're going to talk about mindfulness just a little further into this presentation, because it's critical to be able to be present in the moment so that you can respond in a thoughtful way and not necessarily react. But in the moment, recognize, scan what you're feeling. Most people are pretty adept at doing that. Again, there can be a mix of emotions, but we're pretty good at identifying what's the dominant emotion here. Am I really feeling anxious? Am I feeling really angry and ticked off? Then map it. So you identify the thought that is behind that emotion, okay? And again, this can be easier or more difficult to do depending on the situation, but then you zap it. Now, early on, you might want to even write down what that thought was. I think over time, very quickly, and many of us can just sort of in our own minds, if we can stop and be present enough, you can examine that thought and question it. And very often, that will allow you to make a more thoughtful response, or to really diffuse the emotional reaction that you may be experiencing. And again, that could be the comment, it could be the person cutting you off, or what have you. And as I've said, the more you do this, sort of like any other tool, kind of the quicker, more adept you become at doing it, the more emotional regulation you begin to obtain, and again, this ability to respond in a more thoughtful way, as well as sort of diminish all of the kind of feelings that are associated with, and physical, whatever, and other stress that's associated with these sort of less controlled emotional responses. I would think, we'll segue to this idea of making a self-care practice, and this is all a part of it, right? How do we care for ourselves? And certainly learning to manage our emotions is one critical piece, but what else can we do in this moment? I think we're all pretty well aware of what happens if we don't take our, time to sort of charge our batteries, charge our cell phone every day, right? It's not going to continue to function the way that it could, or the way that it should. And yet, we know it can be very difficult to do that, to make that time. We know that we don't make time for self-care, we can feel stressed, we can feel burned out. I included this is sort of hot off the presses. Now, this is related to physicians, but we know the data is consistent sort of across all of us working in healthcare and in other industries. I'm sure the numbers are very similar, where in this moment, about 71% of physicians surveyed in this case were experiencing burnout. And again, looking at other surveys across all other industries, we know stress is up, burnout is up, and there can be many reasons and components to it. I mean, certainly contributing to burnout is this idea that, the demands that were being put on us just are exceeding our resources to deal with them. And those are demands that are certainly are at work, but our demands are from our home and our personal lives, and increasingly in the world we live in, and I'm going to talk more about this, there is really this integration and not this sort of walled off separation between, our work life, quote unquote, and our personal or home lives. We know that there are a number of sort of risk factors for burnout, things to think about. I just want to make this point, by the way, that I am certainly well aware that a lot of what drives burnout, okay, is organizational issues, right? There's so much we need to do to address burnout, and this is not a lecture on burnout. And things with electronic health record, activities that are really could be more efficient. There are all kinds of things that need to happen. What I would say is in the midst of trying to bring about those changes on an organizational level, just like in the midst of a global pandemic, which understandably is going to be stressful, we still owe it to ourselves to do what we can to care for ourselves, right? Even while, we're doing the other work we need to do to develop a vaccine or streamline the electronic health record or whatever it might be. And so that's what I wanted to focus on here, because it's what we at least potentially have the most immediate control over, okay? And again, going back to what I was saying, it relates to things that we do have a certain modicum of control over very often, even though it can be challenging. Things like getting enough sleep. If there are really conflict between work and life and what we might be able to do there, we're going to talk about some strategies in a little bit. If our relationships are under stress, if our relationship is at work or at home are under stress, right? And I know for me in my role here and just in general, thinking a lot about well-being, I think the focus needs to be on helping people to live their best lives. I mean, the things that impact our well-being go well beyond what we might be doing at work, well beyond what we might be eating or whether or not we're exercising regularly, things that are critically important. But really we want to think in a more comprehensive, holistic way about those things that impact our well-being. Again, as I was talking about earlier, being able to manage our emotions better so that we're not experiencing just always being angry or anxious or whatever it might be. Finding ways to unplug. It's interesting to think through, and literature just beginning to come out on this now. I don't think we even have a clear understanding on how this moment is impacting work-life balance and integration. I'm imagining, and I, for some, it's been great. I had a patient the other day say to me, this has been great. Her husband hasn't needed to travel, and for the first time in years, they're able to spend a lot of time together. Yet at the same time, they've needed to figure out sort of how she can have her space when she needs to work, and they're not kind of stepping all over each other. One could certainly imagine if relationships were more strained at home, that might make it even more difficult to sort of, if you're working at home more now, or a loved one is, to sort of create the right environment for you. And then, this idea that maybe you used to get up and go to the gym and then go to work, maybe, or go for a walk or whatever it is, and before you go to your office. Now, if you're working from home more, you wake up and you're at the office, and it's easy to sort of dive right into the things that are there, let alone sort of doing those things at night and on weekends and what have you. And then, of course, when we're not managing the stress, the overwhelm that can cause for us, sometimes we turn to, quote unquote, self-medication and things that ultimately are detrimental to our health. So what do we do about it? Well, what I'd like to emphasize today is this idea of taking one small step. I actually really like this book called Mini Habits. It was at Stephen Geis, I believe, is the author. And in the book, it's interesting. He talks about, if I'm recollecting correctly, when he first sort of came up with this idea, and he decided he wanted to get in better shape. He wanted to commit more and develop this habit of exercising regularly. But what he committed to was 1 push-up a day. That was it. Now, I would imagine even on his worst day, I mean, even if he had the flu, he could at least maybe crank 1 push-up out. And on most days, he was able to do 10 or he felt like more, but almost no matter what, he was able to get at least 1 push-up done. He got home at whatever time, you at least get one done before you brush your teeth. And again, what that did was, sort of probably through a process of some neuroplasticity, but it was able to allow him to be successful with that goal, that habit, and of course it built upon itself and then led to other habits. So this idea of 1 small step, as opposed to, gosh, that was a great talk by Perlman, I'm gonna go on a vegan diet, I'm hitting the gym 7 days a week, and I'm gonna meditate for an hour every night before I go to bed, whatever it may be, and then you kind of burn bright and burn out. So where do you begin? That can be a little tricky because you really want to begin with some goals that really resonate with you the most, what you would maybe prioritize. That being said, if you'd like a suggestion, I might suggest starting with something that helps you feel more energized. We know that without energy, nothing's going to happen. I mean, without ATP and our energy in our bodies, there's no life. And so, you know, if you focus initially on something that's going to help you to feel a little more energized, often that can then fuel, in the long run, you reaching some of your other goals. And we can do that by sort of taking a personal inventory around sort of what lifts us up and what drags us down from the perspective of energy. So, you know, you could do this now, take a pen and a piece of paper if you have a second, you know, or you can do it when you get home, you know, write down 2 columns, energy out, energy in, and spend a few minutes thinking about what are those things that typically come up in your day that just tend to drain you, okay? Or, you know, if you do or don't do them, you just get really drained. And then on the other side of that, what is it that makes you feel more energized? You know, if you eat a good breakfast, does that help? If you exercise regularly, you know, if you make sure to spend some time with friends, you know, or at least checking in on the phone nowadays, or with a FaceTime or whatever, are those things that tend to make you energized. And look at that list. And then from there, you really can come up with your one small step, one small idea, what you can do for you to begin to feel a little more energized, right? And think that through. You know, I've used different tricks for this. I mean, sometimes you can piggyback it on things you normally do already. As I've said, I have 5 kids, actually just became empty nesters for the first time in 27 years, just maybe a month or so ago. And one of the things I wanted to do was make sure to check in with the kids. Worked out nicely for me, 5 days in the week. I thought, all right, I've got about a 15-minute drive from Mayo to my home, and why don't I just call one of the kids? You know, each time I drive home, that's sort of wasted time or whatever, nice time. And you know, if I had trouble remembering that, I could have put a sticky note on my you know, dashboard. But most times I can remember. I'm sort of piggybacking these things. You know, when you get in your car to drive home, you know, why not give one of the kids a call and just check in? So, you know, that's not too onerous on me. And again, but I've listed a number of things here that one might decide to do, you know, and my main recommendation would be not to overcommit, but do something that you think you can do with consistency, and then build from there. So one of the things that holds us back at times from even wanting to take a step, even one small step, is that we're already feeling overwhelmed. We're already feeling like work and life is out of balance. Now, I like the concept of work-life integration better. I certainly didn't make it up. I think I first read about it in the Harvard Business Review, actually. But in that article, what I remember was, you know, this idea that balance sort of implies 50-50. So, you know, if you think about work-life balance, you're almost setting yourself up to fail right off the bat, because few of us spend 50% of our time at work and 50% of our time in our personal lives. So, and it just doesn't work that way for most of us. So how do we effectively integrate sort of our work lives with our home lives? And you know, what keeps us back from doing that sometimes? So one of the things that can make that challenging for us is what, again, the positive psychologists refer to as our iceberg beliefs. Now, these are big beliefs about the world, ourselves, our place in the world. You know, if you catch yourself saying should or kind of need to, often if you stop, there's a bigger belief behind that. And these are often influenced by our upbringing, you know, the people around us, perhaps our parents, what have you. And they certainly can relate to many things in our lives, of course, but our challenges around work-life balance and what have you. Now, there's achievement icebergs, for example. Now, they can push us to work harder, and they're not necessarily, these are not good or bad, right? They're a double-edged sword. So an achievement iceberg may be this belief, and again, not that you have to word it this way in your head, but being successful is what matters most. So this drive for success, right? Now, that obviously can be a wonderful thing if it's helped you to accomplish all you've been able to accomplish. If it drives you to say yes when you should say no, or, you know, not go home and spend time with the family when that's really, you know, maybe the better thing to do, you know, then it can become problematic. You know, social icebergs. I should always be there for the people I love. Well, that sounds on the face of it like a wonderful thing, but not if it drives a bunch of guilt because, you know, you're trying to get done the project or you know, do what you need to at work and be there for your loved ones and you know, do your best to also care for your ailing parents, and then sacrificing your own self-care, right? Because there's just so many others around you that you're trying to care for without really taking the time perhaps to love yourself as much as you love everyone else around you. Control icebergs, and they can push us at our shortcomings, sort of in the midst of all of that. An idea that I should be able to do it all, which, you know, can then drive us not to delegate or say no, when maybe that was sort of the better answer for us. So one thing you can do, you know, beyond gaining a better understanding of our iceberg beliefs, because with insight comes choice, okay, is this, that I actually learned really a number of years ago at a time where I was in New Jersey. I'd taken on, this prior to Duke, I'd taken on a number of responsibilities, including chair of a department, and had my first NIH R01, and you know, quite frankly, was just feeling overwhelmed. I think probably had all 5 kids at home at that time. I'm sure I did. Fortunately, I had some discretionary funds, and I remember speaking to my dean, and I said, you know, more than anything, I need an executive coach, and I was able to sort of start working with this executive kind of leadership coach, and I learned a version of this from him initially, kind of tweaked it a little bit, but to me, this was like, it seems in some ways so simple, but it was really revolutionary, and I use it to this day. And it's this idea of delegate, delete. I've now added in delay and do. So what does that mean? You know, here you are, you've got all kinds of things on your to-do list. Actually, keep a couple to-do lists. Keep the personal one and the work one, and then there's like a third one that seems to be like this mix, but the things that are kind of priorities. But, you know, you can do this anytime during the day. This is a good Monday morning activity, or whenever you're feeling that sense of overwhelm. And again, remember we were talking about earlier, right? You have to be able to drop into the moment and recognize what you're experiencing. Okay, I'm feeling kind of overwhelmed right now. You can look at all the things you have to do, what's driving that, and then ask yourself, can I delegate some of this? Is this something I could hand off? And ideally, is it something I can delegate where maybe there's an advantage for the other person as well, and not sort of a quote unquote dump that we don't like to do. But that can be in our work lives, you know, where maybe there are things that you could ask others for help with, or our home lives. And maybe, you know, boy, I'm going to be at work late tonight. I don't think I'm going to be able to get to the cleaners before it closes. Maybe I'll call my wife and ask her if she doesn't mind doing that, but maybe I'll also offer to do some of the food shopping on the way home, because the supermarket's open later. Is there anything I can delete? I think this is important too. You know, this may not be everyone. Maybe I'm alone in this, but when it's on the list, like I'm looking at it and I'm feeling like, when am I going to get this done? So, you know, if you've had clean the garage on the list for 4 weeks, I mean, either just go and do it, or let's just take it off the list. We'll get back to it later. It can't have been all that important. So sometimes just deleting those things that just aren't getting done, you know, again, will give you a little more of a sense of peace and calm. More often, there's an opportunity to adjust the timeline. And I always give this example. You know, I had written this book chapter, and with 2 other colleagues, and it was due for a revision, and the revision was due, and one of my co-authors was really not getting me the material. She was going through a bit of a transition career-wise, and just having trouble getting the work done. And to be very honest, I was too busy to do it for her, and I was feeling angst about this because it was due. You know, at like the end of the month, right? This was a little while back. And so, you know, with some trepidation, I like to get things done on time and deliver for people. So with some trepidation, I emailed the editor and said, you know, I'm really sorry, but do you think I could have another week? And she immediately emailed back and said, oh, don't worry, no one gets this done on time. Take another month. So I said, great, thank you. But I learned from that, because it's funny, another revision was just due July 1st. And again, a lot going on, obviously, in this moment. And I even already had said to my co-authors around middle of June, you know, try to get this to me by mid-July. I'm going to ask for an extension till August, and I know we'll be good. And that's what I did. But, you know, again, very often, if you look, there's the ability to adjust that timeline. Not always, but often with many things we can do that. And then finally, it's really, you know, do. What is it that I just need to get done? You know, let me just do this, you know, whether that's first thing today, and often even in your day. I mean, if you're, you know, it's kind of, what can I crank out? Let me get these 1 or 2 or 3 things done. And then, you know, we'll see how the rest of the day goes. So delegate, delete, delay, do. You know, another related issue in terms of getting things done is, and this is one where I will, again, totally admit that I struggle. As much as I know the literature that says if you don't multitask, if you do one thing at a time, you know, you're going to get more done, you're going to be more efficient. It's still so tempting for me during these multiple Zoom calls we do to, you know, kind of below in my lap, I'm just checking the text or the emails because I don't think anyone can tell. So I am working on that. And I think we all could probably benefit if you're like me and struggle in trying to be a little more focused on that one task. I think when I talk about mindfulness in a moment, I think it's really critical in our relationships. That's really where I've tried to be more of a master of monotasking. I think, you know, we maybe always can't be there with our loved ones as much as we'd like, but if we're with them and, you know, physically in our minds or somewhere else, or we're just checking emails all the time, you know, I think that can really put a strain on our relationships and on ultimately the quality of our lives. Another thing I want to emphasize in this moment in particular, and again, for some of you with your routines changing, maybe you're not working from campus as much or from the facility, is to really come up with a routine and that you stick to. And nowadays in particular, putting into that routine the self-care components of the things that you want to be doing. You know, I've always said for years to my patients, you know, schedule your workout just like you would lunch or dinner. Maybe dinner is even a better example. You know, most nights around 7 o'clock, give or take, you're going to eat dinner. Now, for many of us, there may be times where you've missed dinner. You know, when you do that, you don't feel great, but most nights you're going to get that dinner. Now, I'm not saying you have to exercise every single day, but putting it into the schedule, or ideally even some opportunity to be physically active every day, whether it's just walking to your around a little bit, whatever it may be, a 5-minute walk, you know, scheduling it like you would lunch or dinner can be one way to be more consistent and actually be able to do it. Scheduling breaks, even if they're 5-minute breaks. You know, once I get this done, it's a 5-minute break, or at this time, 5-minute break, and trying to be good about those kind of things. Can be really, really important in general, but as I've said, particularly during this moment. So I've alluded to this a number of times, this concept of mindfulness. Many of you may be familiar with it. It certainly is a well-studied sort of innate capacity that we all have, and you know, it as I've been talking about, it's a key component to managing our emotions, responding to things differently in our environment, being able to stay committed and really execute on those sort of things that we've committed to, those intentions that we've set. What I want to say first and foremost is this need not be you, or, you know, meaning, you know, you don't need to be a meditator, okay, to be mindful, to strengthen your ability to be mindful. I mean, one way that mindfulness gets defined is this idea of awareness, or paying attention to the present moment on purpose. So it's being present. Now you'll see the first word there is non-judgmental, because there is this human tendency for many of us, as we become more aware, maybe we're more aware of ourselves, the way we are reacting to certain things in our environment, maybe behaving that maybe we don't like so much. And again, with mindfulness, there's an emphasis. This isn't about self-judging, but as we become more aware, hopefully we have the ability to make different choices. So really, and I was mentioning about relationships, you know, this idea, are you mindful or are you mindful, right? Not going to spend a lot of time on this, but as I've already said, there's a large body of literature on certainly the physical benefits of mindfulness, the emotional and mental benefits of mindfulness. There's evidence on actually making better decisions, which I found really fascinating, and making decisions more consistent with our values, you know, who we want to be. You know, and for me, when I first started practicing a little more mindfulness and learning about this, it was like, well, even what kind of father do I want to be? You know, if my son spills the milk, do I go, what's wrong with you? Or am I more mindful? And even though I may be aggravated, you know, on one level, am I able to sort of be more mindful and say, you know, we've talked about trying to be a little more careful, come on, let's go get some paper towels and clean that up. And you know, again, more consistent with my values in terms of who kind of father I want to be. Mindfulness is like a muscle. It can be strengthened. Okay, we all have the capability. We all know people who tend to be more present, and we all been in certainly moments when the person across from us seems like they're not being very mindful. Maybe the lights are on, but it doesn't seem like anyone's home. It can be cultivated, it can be strengthened more formally, and that is where things like meditation, mindfulness-based stress reduction, these are things that have been developed over years, in some cases centuries, as a way to become more aware of the present moment. But in a more informal way, you can just choose to try to stay focused on what's going on right now, or later tonight when you take a walk or sit on a park bench, or whatever it may be. You know, can you smell the smells? Can you feel the wind? You know, those sorts of things. If you set that intention, it's really when you notice that your mind has wandered and you bring it back to whatever you decided to focus on, that's the rep, if you will, that's going to strengthen the mindfulness muscle, okay? So that's again where this non-judgmental piece comes in, because you know, if you're like me and like to do things right and get it right, you know, it's like, oh, my mind keeps wandering. It's not, your mind is gonna wander. It wanders for everybody. I mean, it probably wanders for the Dalai Lama. Everyone's minds wander, right? But what the key is to bring that mind and that wandering rather back to the focus, all right? And over time, again, that strengthens your ability to stay more focused on whatever you choose to focus on, gets enhanced. Now, of course, there's a ton of apps out there, you know, that one can use. And so if you find mindfulness practice more challenging, you want a guide, this is just a few that they often offer a little bit of free, and then if you pay, there's more. So finally, I'm going to end sort of with this concept of finding the good. I want to certainly note that although we've talked a fair amount about the negative emotions, obviously there are many wonderful positive emotions, including one that we're quite big on here called joy. Maybe you've heard of it here at Mayo. And, you know, it's not just about removing the negative. It's not just about trying to not spend so much time in the negative emotions, but how do we also find ways to feel positive and joy and love and all those things that really enhance our lives and our relationships and our experience of life. And, you know, it's interesting. I mean, let's just be honest, just all of us, right? There's often a little bit of a selection bias on who even attends a lecture like this. And I thank you all for attending. Sometimes the people that maybe need it the most don't necessarily sort of sign in. And some of this stuff can feel kind of touchy-feely, and that's okay if it does. It's not about this is the tool you must use. But if you don't have the life that you would like for yourselves mentally, physically, or emotionally, or spiritually, certainly doing nothing is unlikely to change, or keep on doing what you've been doing that's created the reality for you is unlikely to lead to a different experience. And so, you know, this certainly may not be something you do, but life is a journey, and certainly finding what tools, what processes work best for you is really a major part of that journey if we want to create, again, our best life. So this is a simple one that you can try, maybe not now, so you can stay focused on the talk, but as soon as this talk ends, later tonight, you know, we used to do this thing when the kids were all home, you know, for dinner, we just go around and everyone just say one good thing that happened to them that day. And it could be someone opened the door for me, but it just trains our minds to not always be looking for that saber tooth, you know, to take some time to really look for the butterfly as well. You know, it's interesting, and some of you, I'm sure, on this call manage teams. This has become interesting in our new normal, and a number of us that are interested in well-being are working on how to best manage teams and keep people engaged in this moment. This is some research that looked at, you know, the top issues that keep people most engaged at work. And here were the top 5 that came to light. And if you look at this, if you had to prioritize them, what do you think the priority would be? Now, I'm not sure what you just thought there. And I'll tell you, here's the way it came out in one particular survey. And it didn't mean that salary and benefits weren't important. But quite frankly, number one, people listed meaningful work, a connection to a bigger purpose, right? And how do we do that? And for those of you managing teams, and particularly maybe if some of those individuals may be at home now, how do we help them to stay connected? Particularly if they're not coming into our facilities, maybe seeing directly or indirectly, let's say, the patients that we care for, and being reminded of the special mission of serving the needs of our patients that we do here at Mayo and within healthcare. And then number two, support for work-life balance. How does that happen? Of course, there was still praise and appreciation for manager was a close number three. Job security, this was prior to COVID, of course. I'm sure that's come higher up in many people's lists. And then salary and benefits certainly were important, but they were actually last out of the five that came to light. So what can we do about that? You know, again, we don't need to be a manager to do this. I think this goes across, up and down, across wherever within an organization, but it can be as simple as taking the time to say thank you, showing appreciation. You know, sometimes writing a thank you note can be very powerful, both for you as well as the person who receives it, and really can make a difference. You know, it can be little things that really make you feel good. You know, today I got into work and some of the nurses and others, there was balloons and a "You Rock" sign thing by my desk. I walked in, I was like, whoa, and a nice birthday card and 3 really healthy granola bars, which was interesting. But, you know, small thing, but boy, it really made me feel good and feel appreciated and feel good about being here at Mayo Clinic and the wonderful people that I work with. So a couple of quotes here. And again, I'm moving into some content that Melissa McCrary really made me aware of, and I really thank her for that. So processing life through a grateful lens does not mean denying negativity. This isn't something that's supposed to be this Pollyannish thing, but it's not a form of superficial happyology, but instead it means realizing the power you have to transform an obstacle into an opportunity. It means reframing a loss or potentially a challenge into a gain, recasting negativity into positive channels for gratitude. That relates to this concept I think is critical for all of us as individuals, maybe as units or departments, and certainly as an enterprise, right? And you know, and with the Wellbeing Coalition here in Florida and with the leadership, you know, this is the way we're thinking, right? And I know this is happening across the enterprise, and we're doing this in collaboration with many of wonderful people across the enterprise. You know, how do we come out of this? How do we grow? Not just get back to where we were, but really grow from what we've just come through and are continuing to go through. And this idea, I think, post-traumatic growth is really critical. Again, you see some of the history here. It is this idea, when we hit these major challenges, that really challenge our assumptions about maybe our future. And it can lead to a lot of anxiety, and it can be difficult to manage, right? That growth, though, has the potential to extend not only sort of, oh, we're going to look at new ways of doing things over the next few days or weeks, but really years. But it comes with intention. It comes through really carefully reflecting and looking at what is this moment, what's coming at us, and how can we respond in a way that we really can grow, maybe develop some new ways of thinking or behaving. In that regard, it does vary from resilience, which is sort of being able to respond, right? We certainly want to be resilient because as we reach that new level, we want to be able to maintain it. But, you know, it does come from struggle. You know, I heard this a long time, this metaphor of, you know, to make a plant strong, you don't just throw the seed on top of the soil. You have to dig a hole, put it in, put the earth in, and pat it down, and then give it some water. And it needs to push through the earth for those roots to take hold and be strong. So, you know, again, we often need support through times of our lives when we're struggling, but we can try to be intentional about creating growth through that struggle. One way to do that is through this concept of gratitude, and it's really important, an important concept. I think we all have a sense of what gratitude is. I'll read this quote. Consciously cultivating an attitude of gratitude builds up a sort of psychological immune system that can cushion us when we fall. There is scientific evidence that grateful people are more resilient to stress, whether minor everyday hassles or major personal upheavals. So let me show you just a little bit of that science. This was a study out of Korea that looked at post-traumatic growth. And what they found is that when people were facing these challenges, these moments of great challenge, and did what we all tend to do, you know, start to mind wander, we get, you know, what often that term often is called rumination, intrusive rumination, that if we can focus on gratitude, it can be a bit of an antidote, and it can lead to this post-traumatic growth. if we can, again, focus on gratitude and how we might want to evolve from this moment. So how might we do that? How might we find ways to focus more on gratitude? And again, I'll go back to what I said earlier. This is not like everyone should run out today and buy a gratitude journal. Some people that's going to feel like the right move, and they're going to like jotting things down or what have you. Others, that's not really going to resonate with them. Even things like mindfulness that'll resonate for some, not for others. But it is one way that you can begin to stay more present to whatever you intend to stay present to. And if part of that is the things that you want to be thankful for in your life, in your world, in your environment, then mindfulness can be helpful there. It can be writing thank you notes, as I've said earlier. That's a way not only to show gratitude, but remind you of those things that you are thankful for. Some of us get it through religion and prayer, and sometimes even as simple as finding time with loved ones. And I've often said, my wife and I, obviously we have 5 children, as I've said, 5's a lot. We're both from big families, but one of the things I realized was that part of the reason, and again, not that this should be for everyone, but certainly, those kids are part of what we feel connected and thankful and keep me grounded. And so, I think there's a lot of things in our lives, if we take the time to stop, that we can really be thankful for. And so, what I wanted to express to all of you is that making the time to do that can have very real, very tangible, very positive benefits on our lives, as well as the lives of those around us. So I'm going to end with this quote, and we'll have a few minutes for questions. So gratitude turns what we have into enough and more. It turns denial into acceptance, chaos into order, confusion into clarity. It makes sense of our past, brings peace for today, and creates a vision for tomorrow. I am feeling gratitude for the opportunity to give this talk, and that all of you chose to come and attend it today. So thank you very much. And we'll open it up for questions.
Thank you, Dr. Perlman, for being here. So please feel free to submit your questions by hitting the Q&A icon. At this point, I don't have any questions, but in the meantime, if you wouldn't mind participating in a little gratitude chat, as Dr. Perlman said about just focusing on the good. So if you just open up your chat and list what's one good thing you're grateful for today, please share that. Thank you so much. And we will be in touch after this webinar to send you a video link if you'd like to rewatch it. A few things that you're grateful for: family, the emphasis on great male resources, this amazing talk. Kimberly says the sun came out, my health and my children I'm grateful for, Mayo's commitment to employee well-being, superb content, thank you for that. I'm grateful for a new chair, love it, thank you. And I will check the Q&A here. Can our patients request to be seen in integrative health well-being as a part of their annual exams or one-time visit at Mayo? Do you know the answer to that, Dr. Perlman?
Sure. I don't want to misspeak. I think I know the answer for our enterprise, or at least I know the answer for Florida, Rochester and Arizona. I'm a little less adept at some of the different locations in Wisconsin and other areas, but obviously here in Florida, I see patients, and then I'm happy to see them. We have acupuncture, massage, mind-body medicine, nutrition, of course, and similar services, health coaching. We actually just started for our patients health coaching here on the Florida campus. And then certainly on our other campuses, there are robust integrative medicine programs that patients can be referred to. Again, I think the question may relate to the annual physical, and that's just a matter of coordinating that, I believe. Certainly we see a lot of our executive health patients and integrate those visits when it's appropriate or when it's required or requested.
Thank
So I'm
you.
sure it could work with other annual visits.
Okay. Another question, Dr. Martin Seligman recommends when listing your 3 good things to think about why they happen. Does your experience support this as a boost for this form of gratitude?
Let me say that back to you because it was a little hard to hear you. I believe it was the concept that not only putting down, let's say, 3 things that you're grateful for, but why.
Correct. Yeah.
Yeah. Well, I think, you know, what can be very important about that is again, this idea of gaining insight. You know, as we gain insight to ourselves and sort of what's important to us, like, why did you pick those 3 things, right? You know, what was it about those 3 things that your brain went to of all the things that might have happened to you, you know, throughout your day? And that can point back and give us more clues as to what it is that really we find to be the most purposeful, the most meaningful to us. And with that level of insight, that can help us decide where we want to focus. You know, if it was 3 things related to connecting with loved ones or friends, you know, that gives us some real insight around, that's something that I think I need to make time for, because clearly it's an important concept as it relates to not only feeling thankful, but, you know, living my best life.
Yes, thank you. And last question we will take is written, are there books you suggest to support what we learned today to help it stick? Any books?
Yeah, I certainly can give the name of the book that I wrote. We're allowed to do that, right? I mean, it's 14 Days to Cooler, Calmer, and Happier, which that talks more about this you know, map it, trap it, zap it from positive, trap it, map it from positive psychology. So there's that concept is in that there's so many books out there, and maybe that's, Bridget, something we can actually follow up with, you know, in terms of the books out there. You know, it really is kind of what resonates with you. But, you know, if it's mindfulness, there's excellent books by John Kabat-Zinn, Z-I-N-N, wherever you go, there you are. There's the name of one of the books, but there's many of them out there. What I often find, maybe is a less direct answer, but, you know, even nowadays, I think we can now do it again with the mass. It's a little trickier, I find, to do this online, but actually going to a bookstore to that section and just, you know, taking 10 or 15 minutes to sort of pull some of the different books and see if you just kind of hit something that really resonates with you. And, you know, there's a book called The 4 Agreements. I really enjoyed that book. I've read it now a number of times, but that doesn't mean that that's going to hit everyone else the way it hit me. And so, you know, I think doing that, I'll do that periodically. I'll just go to that self-help or whatever section and just kind of look through and say, And sometimes, you know, whatever's maybe really resonating for you the most in that moment, if you take a few minutes, there's the book for that. And so, like, that book seems to be the one I need now, as opposed to maybe a month or 2 from now, or it's a different book that may be more relevant to what I'm experiencing in this moment. So I hope that was helpful.
Yes, thank you, Dr. Perlman. Well, we're going to end a few minutes early, so you have a little time to get to your next meeting or wherever you're headed, but I will send a follow-up email with other resources for you. So thank you so much for your time and attending today. Take care.
Thank you all.